I'm Mark Chang, and I would like to speak to you about 1-month dual antiplatelet therapy in patients with high bleeding risk undergoing percutaneous coronary intervention. These are my disclosures. We are all familiar with the different risk factors for high bleeding risk in patients undergoing PCI. There are several trials that have been done on patients with high bleeding risk undergoing PCI. It's important to note that not all trials had the same inclusion criteria, and some trials were more broadly inclusive of patients across the scope of bleeding risk factors. These trials, such as the Onyx 1 trial, would have results that would be more generalizable. The Onyx 1 global trial was a multi-center, single-blind randomized trial of patients with high bleeding risk undergoing PCI. Patients were randomized to either the Resolute Onyx Zotarolimous eluting stent, a permanent polymer stent, or the BioFreedom drug-coated stent, a polymer-free stent. Both groups were treated with 1 month DAPT, followed by single antiplatelet therapy, and followed up for 12 months for the primary safety endpoint. This slide shows that more than 50% of patients in both groups were switched to aspirin monotherapy after 1 month, and slightly under 50% of patients were switched to monotherapy with a P2Y12 antagonist after 1 month, mostly clopidogrel. The headline results show that there was no difference in the composite primary safety endpoint of cardiac death, MI, or stent thrombosis between both groups. Similarly, there was no difference in BARC bleeding events between both groups at 12 months. In conclusion, the Onyx 1 program showed similar safety of 1 month DAPT with the Resolute Onyx permanent polymer Zotarolimous eluting stent compared with the BioFreedom polymer-free drug-coated stent. It is important to note that 1 month DAPT is not suitable for every HBR patient, and that there will be HBR patients who may require more than 1 month of DAPT. For example, HBR patients who undergo multi-vessel complex PCI and would therefore be also at high ischemic risk. Moreover, for patients who are on oral anticoagulant, perhaps for the common indication of stroke prevention in atrial fibrillation, caution must also be exercised with shortening DAPT below 1 month, as this is shown to be associated with an increased risk of stent thrombosis. Thank you very much for your kind attention.